A case study on identification of parasitic disease of milkfish and its prevention and control. This is Mariel A. Halili, the presenter. Objectives. At the end of this topic, the student will be able to identify the parasitic diseases of milkfish, to discuss the symptoms, causes, prevention, and control of these diseases identified, to discuss the effect of the diseases in production. Parasitic diseases of milkfish. Number 1. Nematode infestation. Nematodes or roundworms infect many different species of aquacultured and wild fish. Small numbers of nematodes often occur in healthy fish, but high numbers cause illness or even death. Symptoms: emaciation, wasting or significant loss of body mass, nodules or masses present in skin or muscle, stunted growth, abnormal swimming, weakness, become listless or loses appetite. Cause: in aquaculture situations, fish become infected with nematodes if they are fed live foods containing infective live stages, or if they are raised in culture settings that promote the growth of other animals that carry the infective stages of the nematode. Vector or parthenic hosts, or allow nematodes to complete their life cycle, or intermediate hosts. Some nematodes can be transmitted directly from fish to fish. Adult nematodes are typically found in fish digestive tracts. However, depending upon the species of nematode and the species of infected fish, adult and other life stages of nematodes can be found in almost any part of the fish, including the coolomic or body cavity, internal organs, the swim bladder, deeper layers of the skin or fins, and external muscle layers. Prevention: ponds that have not been cleaned or sterilized prior to restocking are at greater risk of harboring large numbers of intermediate hosts. Cleaning and sterilizing ponds is an effective way of reducing the numbers of the intermediate hosts of some nematode species. Preventive medicine can also help the producer avoid illness and production decline. Treatment: administer trifluorphon with caution or for small fish, niclosamide, levamisole, or mebendazole mixed in feed. Prevention: proper identification and correct therapy for treatable infestations dramatically improve the health and productivity of affected fish. Anchorworms disease. Anchorworm causes lernaiosis, a parasitic disease of freshwater fishes. Anchorworm is much more capable of causing disease in native freshwater fishes than its natural hosts, goldfish and carp. This is because native freshwater fishes have limited defense behavior and a weak immune response. Symptoms: parasite visible on skin, head embedded deep in the tissues is the host, hemorrhages and open wounds at site of infection, respiratory difficulties, ulcers, scale loss, fin damages. Cause: anchorworms occur where a new fish is added to an aquarium carrying juvenile anchorworms or a reproductively active female in their skin. Skipping proper quarantine makes this parasite spread very rapidly. A single female anchorworm can produce hundreds of larvae every 2 weeks for up to 16 weeks in 77 Fahrenheit 25 Celsius in tank. Prevention: the best method of preventing anchorworms is properly quarantining any new additions to your aquarium. If you see any anchorworms present in a tank of fish you are looking to purchase, assume they are all contaminated. Treatment: they will need to remove the entire parasite, including the feeding end, from under the fish skin. Depending on the level of infestation, sedation makes the process less stressful for the fish and allows the veterinarian to work more effectively without skirming fish. Treating anchorworms with organophosphates or diflubenzuron or dimilin is effective. but needs to be undertaken with severe caution. Trichotinosis. Trichotina is a relative mild parasitic disease and usually made worse by a poor water quality. Mature fish will show signs of flushing and with severe infestations, may be anorexic and or poor body condition but rarely die. Younger fish are more susceptible to experiencing mortality with heavy infestations. Symptoms: slime-covered skin like fog, fins clump, denuded of tissue. Cause: bad quality of water. Prevention: to prevent infection with trichodina, it is important to feed fish during the summer months on quality feed, containing all important nutrients, vitamins, and minerals to a large extent. A properly functioning filter equipped with activated carbon brings relief, because this carbon can purify water from all kinds of microdust particles. Also, various pathogenic organisms are filtered out with it. Treatment: 250 ml liter formalin bath for 15 minutes. Cryptobia infestation. Cryptobia are parasitic on the blood of fish. Free spindle-shaped Cryptobia are ectoparasites as well as intestinal and vascular parasites. It has been shown that an ectoparasitic phase occurs in two vascular species. Symptoms: dark coloration, increased mucus buildup, occasional appearance of skin lesions followed by skin loss, difficult or rapid breathing. Cause: it causes diseases in many species of marine and freshwater fishes. The parasite may be on the body surface or gills, ectoparasitic, in the digestive tract. Prevention: abundant natural food of suitable species and side composition preventing the condition impairing of fish is a basic preventive measure in rearing the early stages of fry and preventing the protozoal infection. Treatment: treat with formaldehyde 250 ml liter or 10 mg liter malachite green. Place infected fish in fresh water bath or treat with effective antibacterial agents. Caligus infestation. Caligus is a genus of sea lice in the family Caligidae. These species are parasites of marine fishes and could be vectors or viruses. Symptoms: loss of appetite, lethargic swimming, excess mucus production, lumpy body surface. Transparent parasites appear like white patches but are not permanently attached to the skin, fins, and gills. Infested areas have no scales, hemorrhagic or ulcerated. Prevention: good water quality, controlling feeding, routine monitoring of the health status of fish stocks. Treatment: dip infected fish in fresh water, makes transparent parasite visible. Bath in 150 ppm H2O2 for 30 minutes. Fresh water bath for 24 hours. 0.25 ppm Neguvon for 12 to 24 hours, repeated at intervals of several. Effect of the diseases in production. Parasitic diseases are also causing major problems in the milkfish farming industry. Obligate and opportunistic parasites play a critical role in determining the productivity, sustainability, and economic viability of global finfish aquaculture enterprises. Without stringent and appropriate control measures, estimating the true impact of each parasite event, however, is complicated as costs may be affected by a diverse assortment of environmental and management factors and can range from direct losses in production to the more indirect costs of longer-term control and management of infections and the wider downstream socioeconomic impacts on livelihoods and satellite industries associated with the primary producer. A significant proportion of stock losses, however, occur within the hatchery, nursery phases of production, and in many industries, these are factored into accepted as part of normal operational practices. Thank you for watching.